together. There might be competitors in this room when it comes to, selling more product or putting out better products and the like, but we can all come together when it talks about the bigger message. And that's what this is all about. It's about education and information to the public at large, that there's a real need for long-term care planning. Everyone needs a plan for their long-term care, and hence 3 and 4 need more information when it comes to that. We all know, we all see the news, the impact of what long-term care is having on the individual state budgets, on us as a country, is significant and substantive, and we wanted to uniform a message so that when people think of 3 and 4, they think of the long-term care business. So if some people ask, well, where did 3 and 4 come from? And we were so very pleased when our good friends at Prudential put out a study this year, and in their 2010 cost study, part of their findings were that 77% of Americans, actually from age 30 to 65, actually said that they needed to know more about long-term care. And 74% of the people surveyed age 55 to 65 actually said they thought they would need long-term care. So with those stats, that's as close to 3 and 4, or actually better than 3 and 4, so we certainly feel real comfortable with 3 and 4 need more, and that's what it means. 3 and 4 need more information, 3 and 4 need more than health care, they need a plan for long-term care.
The cost of elderly to support them in the long-term care arena is going to be increasing. The number of elderly needing the care is going to be skyrocketing. The state governments are in a critical situation now, and it's only going to get worse as the baby boomers age, and we need that kind of care. One of our big goals in the 3 and 4 campaign is to better connect our industry to the consumer who needs this information. An example of what we're going to be creating and the key messages we're going to be helping to formulate and helping people in our industry to deliver. This booklet, a proven booklet, we know that it works. These are the kind of tools that we're going to be providing to the industry. What we're really trying to do is to take care of the problem with this disconnect. We know the thoughts that we need to deliver. We all know some of the solutions when you talk about long-term care planning. Now we're going to be working to bridge those gaps.
So let's talk about our campaign objectives. We want to provide more public awareness on the need to plan for one's long-term care. To inform the public that long-term care insurance is an option, and to inform the public that health care insurance isn't enough. So how the 3 and 4 campaign is going to do this is, first off, by engaging the specialists within the community. We're going to supply materials to help those agencies, to help those specialists go to their local communities with public relation tools to spread consumer awareness, to spread the education. Think about utilizing the campaign slogan. It's so powerful. I mean, it affects people from the ages 35 to 60. Think about how powerful it is as a specialist or as an agency owner or just an advocate on long-term care insurance planning to be able to call a business and tell them you have something to speak to them about that affects 3 out of 4 of their employees. What about your next door neighbor? Involves an association, it affects 3 out of 4 of their association members. How about this one? You call your local politician, your governor, and say, I have something that's very important for you to talk about that affects 3 out of 4 of your voters. This campaign slogan has power. You know, what makes me so proud, besides being able to speak to all of you today, is what we've already done. This isn't what we're going to do, this is what we've done. Here's a few highlights. We have traction, we're off the starting line. We've already trademarked, we already have brand identity within our industry. We have national exposure, we've been on TV. We have social networking platforms already speaking about us. We're online at www.3and4needmore.com. We have insurance carriers that have already provided funding. We have an executive and advisory board that's helping us through the challenges and speed bumps that any campaign would have when you go national. The campaign slogan is already keyword searched. It's already there. Someone starts typing in 3N, it populates, it's there. The information is there for Americans. This is where the consumer will go to find information to view stories, columns, editorial, video. It will have the activities there to engage all Americans. I'm really honored to introduce our special guest, Dr. Marion. She's a long-term care advocate. She's a nationally recognized Geriatric Care Manager. She's the 2009 Lehman College Alumni Achieve Award winner and the 2009 National Market Merit Award winner. She has public service announcements airing on over 300 radio stations. She's been quoted by the AARP, the Wall Street Journal, the New York Times, USA Today, and the Associated Press. She's a publicized author, and she has a focused reality pilot show which will be coming out hopefully in the near future. So before I turn the mic over to her, I'm going to show you a quick video clip so you can get more familiar with Dr. Marion.
Thousands of them are turning 60 a day. We need some help here, so we called in the big guns today. Dr. Marion.
If you find yourself caring for an aging parent or other loved one, this guide might be a very good resource. Dr. Marion Summers has written Elder Care Made Easier. She's one of the top elder care experts in the country.
No reason that we should have a setting where people should not have confidence that health care and Social Security will be there.
Are they dealing with this? Are they addressing the issue?
Oh, you know, we just have to do a plan that takes care of Medicare, does long-term care insurance. You know, we just got to get on it. Otherwise, it's going to hit us in the face.
Wake Up America. I'm trying to get to people and have them be proactive so that they start thinking about these issues before a crisis happens.
NPR here in Atlanta heard that Dr. Marion was coming here to support this press conference, to support this hard launch at this industry function about long-term care. Who did they think of the call? They called her. So yesterday, Dr. Marion was here doing a live interview with Mickey Rooney while he was in an NPR booth in LA. Because if he happened to have a long-term care policy, that could have supplied some kinds of choices and options for him. So I'd like to turn the mic over to our distinguished guest, Dr. Marion.
Thank you very much. It's an absolute honor to be here. I have been in long-term care business for almost 40 years. I feel so excited about being here, and your particular product is something that I have talked about since I knew long-term care insurance existed. The problem is the universe out there in the United States does not know your product is out there. I have seen children cry because the furniture in their home has been auctioned off because they can't pay the expenses of caring for grandma. And the piano that was promised to a grandchild gets auctioned off. I've been there when the grandchild is crying. They feel the promises, their future promises have been broken. And we have a country right now that is not able to address the geriatric tsunami that's heading this way. I have been an educator absolutely all my life, and I feel very privileged to be included in this campaign so that we can educate people either through my syndicated column, or we've got public service announcements that are going to be coming out very shortly that deals exclusively with long-term care insurance. The message has got to be, wake up. We have a solution. We have one part of the solution. And you have the solution in your hand for so many people. They just need to know what you have to offer.
I'd like to thank our distinguished carriers for being willing to listen to what we have, understand what we want to do, and support us on where we want to go. If we could all just give them a quick round of applause. We've all talked this message individually, but it really takes everyone coming together. And as Mark mentioned, there's competitors in this room. There's specialists that work for other agencies. There's carriers that have different products. But we've come together to raise awareness to Americans.